everyone. We are group 5 and we're presenting on neoplastic disease, slides 12 to 26. So the treatment of cancer depends on the type of cancer individual has, its location, size, and the current health of the individual. Some treatments offered include surgery, radiation therapy, chemotherapy, and biological therapy. A thing to note is that every treatment comes with health risks to the patient, and we will talk about some of them later on. So surgery as treatment, it is the most effective treatment for cancer, curing 40% of cancer patients. It can be used to prevent possible cancer from developing or spreading. It also used to diagnose and to treat cancer that's in one area or has spread, since even just removing part of the tumor has shown to positively impact the health of that patient. It also increases the efficiency of adjuvant therapy, which lowers the chance of the cancer returning, and these include chemotherapy, radiation therapy, hormone therapy, among others. Also, a type of surgery, palliative surgery, mitigates the disease and or the symptoms resulting from the treatment without curing the cancer. So there are head and neck cancers, and the most common cause of these are a history of substance abuse, and surgery conducted in these cancers in these areas can impact the health of the individuals by affecting certain body functions, as you can see here, which can contribute to malnutrition. This is why the NCCN recommends weight loss of these individuals to be monitored before the treatment, since it has been found that 60% of people with these cancers are malnourished when they are diagnosed, and this can affect the treatment.
So esophageal cancer, it's pretty relatively common in the US. Some risk factors include smoking and or alcohol abuse, as well as Barrett's esophagus, which can be caused by severe chronic gastroesophageal reflux disease. And if you don't know what Barrett's esophagus is, it's basically when the inner lining of your esophagus begins to change into more like a intestinal lining. And then the treatments included are radiation and surgery. Some surgeries to keep in mind are the transhiatal and transthoracic esophagectomy, where the stomach is used to reconstruct the esophagus. And sometimes a jejunal feeding tube is required. For gastrointestinal cancers, we have gastric cancer, which is the 5th most common cause of cancer-related deaths worldwide, although it's not as common in the US. Treatments included are the partial subtotal or total gastrectomy. And then for the intestinal cancers, we have the small intestinal cancer, which is pretty uncommon. Treatments required is surgery. And then for the colorectal intestinal cancer, it's the 3rd most common cancer, and treatments included are surgery as well as chemotherapy. For pancreatic cancer, 7% of all cancer-related deaths, it's as well as the 4th leading cause in men and women. Symptoms included are weight loss, anorexia, malabsorption, and steatorrhea due to exocrine insufficiency, as well as hyperglycemia. Treatment calls for the pancreatic duodenectomy or Whipple procedure with a possible placement of feeding jejunostomy.
Chemotherapy, also known as chemo, there are many different types of chemotherapy drugs that are used today. Sometimes the drugs are used alone or with other drugs or treatments. This is a common cancer treatment that is immersed into the circulation. This is a very strong treatment that starts to fabricate most body systems. This treatment is used to demolish, monitor the size and spread of, and or minimize the size of the cancer. There are also options to get adjuvant chemotherapy or neoadjuvant chemotherapy. Adjuvant chemotherapy is given after surgery to abolish any cancer cells that were missed. Neoadjuvant chemotherapy is given before surgery to demolish the tumor so it can be easier broken down during radiation or surgery. Chemo side effects. Unfortunately, there are many side effects to getting chemo. These include anemia, neutropenia, thrombocytopenia, susceptibility to infection, diarrhea, mucositis, alopecia, which is hair loss, and possibly cardioneurotoxicity. This is due to the chemo trying to attack the cancer cells, but the healthy cells get attacked along the way as well. Radiation therapy. This treatment is used to cure Hodgkin's disease, testicular carcinomas, thyroid carcinomas, localized cancers of the head and neck, and cancers of the uterine cervix. It is also used to control malignant diseases when a tumor cannot be removed surgically or when local nodal metastasis is present. Radiation therapy consists of electromagnetic rays and charged particles that alter cellular and nuclear material. This therapy is very important and causes the most harmful tissue disruption due to the alteration of the DNA molecules within the cells of the tissue.
For radiation therapy, side effects, there's many side effects for all over the body, but the main ones we're focusing on is the head and the neck, and those side effects are fatigue, hair loss, mouth changes, skin changes, and taste changes and throat changes like trouble swelling, and as well thyroid gland is less active. And for the pelvis, stomach, and abdomen, mostly have all the ones in common: diarrhea, fat loss, hair loss, nausea and vomiting, and urinary and bladder changes. So for biological and treatment therapy, these are some of the agents, as you can see on the chart, that make the cancer easier for your immune system in order to recognize them. They also induce the immune system to attack the cancer cells. And in this chart, these are some of the therapy treatments for that, which an example is estrogen receptors, and those side effects could be hot flashes and night swelling. And another example is blocking antigenesis, and the side effects for that is weakness, diarrhea, anorexia, dry mouth, weight loss, and chest pain. Hematopoietic stem cells transplant. This cell transplant is mainly for people with a immunodeficient disease, and as well the immune system cells, they live in your bone marrow or the peripheral blood, and this is the only option for people with PI.
The hematopoietic stem cells, the process goes through 5 parts: the collection, processing, cryopreservation, chemotherapy, and infusion. For the collection, the stem cells are collected from the donor's bone marrow or peripheral blood, and then the bone marrow or the peripheral blood is processed in a lab to isolate, concentrate, and prepare stem cells for storage. The stem cells are preserved by freezing at extremely low temperature and protective solution to keep cells alive until the patient is ready for transplantation. The patients are treated with chemotherapy and or radiation therapy to destroy unwanted cancer cells and develop bone marrow failure. Infusion stem cells are infused into the unhealthy patient. Stem cell transplant is used for solid tumor and certain hematological cancers like leukemia and lymphoma. It starts with cytotoxic chemotherapy to suppress immune activity and kill malignant cells, and then it is followed by an IV infusion, bone marrow or stem cells. For the medical nutrition therapy, for the first weeks post-treatment, a neutropenic diet is given during the immunosuppression period or during the chemotherapy. Graft versus host disease it's thought to be mediated by donor T lymphocytes that induce tissue damage in the skin, liver, and or GI tract. For skin manifestation, it may include mild severe erythromatous papular rash. Liver manifestation, it may include bile duct damage with cholestatic liver test abnormalities. Others would be dry mouth, oral ulcerations, severe diarrhea, and malabsorption.
And with that, we close with the quiz. The first question is common cause of neck and head cancers. Is it A, high-fat diets, B, fat diets, C, substance abuse, D, allergens? The answer is C, substance abuse. 2, pancreatic cancer is the blank leading cause of death for men and women. A, 10th, B, 5th, C, 4th, D, 1st. The answer is 4th. Number 3, radiation therapy kills cancer cells by changing the cells. Is it A, DNA, B, cytosol, C, peroxisomes, D, cell membrane? The answer is A. And with that, we're done.